Your legs warn you. 7. Warning signs in your legs. After 60, you shouldn't ignore. Your legs are not complaining. They are communicating. Most people over 60 accept leg symptoms as inevitable. Swelling at the end of the day. A cramp that wakes them at 3 a.m. A patch of skin that changed color and never quite went back. They attribute it to age, to standing too long, to the heat. They wait and see. Sometimes that is the right call. But sometimes those same signs, the ones that seem like background noise, are the body's clearest attempt to tell you something specific about your heart, your circulation, your nerves, or your veins. And the difference between this is nothing and this needs attention today is rarely obvious without knowing what to look for. This video walks through 7 visible signs that appear in the legs after 60. For each one, we explain the mechanism, what is actually happening inside the body when that sign appears. We separate the common, low-risk explanations from the ones that justify picking up the phone and calling your doctor. And we tell you which signs require same-day evaluation. No generic lists, just the information you need to read what your legs are telling you. Stay until sign number 4. It is the one most commonly dismissed, and the one most likely to be serious. Sign 1. Swelling that appears by evening and is gone by morning. This is the most common leg symptom in people over 60, and the most misread. Mild swelling in the ankles and feet that builds throughout the day and resolves overnight, when the legs are elevated during sleep, is called dependent edema. Gravity pulls fluid downward as you stand and sit. The venous system, which returns blood back to the heart, works against gravity all day. After 60, that system is less efficient than it was at 40. Fluid leaks from the smallest blood vessels into surrounding tissue. Your ankles puff. You notice your socks leave marks. This pattern, swelling that appears and disappears predictably, affects both legs equally, is not painful, and is not accompanied by redness, warmth, or shortness of breath, is usually benign. Heat makes it worse. Long flights make it worse. Certain medications make it significantly worse. Calcium channel blockers like amlodipine, some antidepressants, NSAIDs, and corticosteroids all cause fluid retention as a known side effect. When the same symptom means something different, swelling that is asymmetric, one leg noticeably more swollen than the other, changes the clinical picture entirely. One-sided leg swelling, particularly when accompanied by warmth, redness, or tenderness along the inner calf, is a warning sign for deep vein thrombosis, a blood clot in the deep veins of the leg. DVT does not always hurt. It does not always look dramatic, but it can dislodge and travel to the lungs, causing a pulmonary embolism. Bilateral swelling that worsens rapidly, gaining several pounds over a few days, and comes with shortness of breath or fatigue, points toward cardiac or kidney involvement. The heart cannot pump blood forward efficiently. Fluid backs up in the venous system. It settles in the lowest point of the body. What to do? Predictable, bilateral, painless swelling that responds to elevation. Mention it at your next appointment. One-sided swelling with warmth or tenderness. Same-day evaluation. Rapid weight gain with swelling and breathlessness. Do not wait. The next sign is almost always attributed to dehydration. It is sometimes much more than that. Sign 2. Leg cramps that wake you at night. The sudden, involuntary contraction of the calf muscle that jolts you awake. Most people over 60 know exactly what this feels like. The muscle seizes. Walking it off helps. It fades within minutes, leaving a residual soreness. Nocturnal leg cramps are extraordinarily common after 60. In most cases, the direct cause is muscle fatigue, dehydration, prolonged sitting or standing, or low levels of magnesium, potassium, or calcium. These are the cases where lifestyle adjustments, better hydration, stretching before bed, reviewing medications, make a real difference. But cramps after 60 are also listed as a symptom of peripheral artery disease. When the arteries supplying the legs are narrowed by atherosclerosis, the muscles do not receive enough oxygen during activity, or, in more advanced cases, even at rest. The cramps of arterial insufficiency have a characteristic pattern. They occur in the calf, thigh, or buttock during walking or exercise, and they resolve within minutes of stopping. This is called intermittent claudication, and it is distinct from the cramp that appears at rest, in the middle of the night, without any exertion trigger. Cramps can also be a side effect of several commonly prescribed medications. Statins, diuretics, and certain blood pressure drugs all appear on the list. What to do? Occasional nighttime cramps with no other leg symptoms. Review hydration and magnesium intake, and mention it to your doctor if they occur more than twice a week. Cramps that consistently appear during walking at a reproducible distance, then resolve with rest. Ask specifically for an ankle brachial index test. It is non-invasive, inexpensive, and can identify peripheral artery disease before it progresses. Sign number 3 is visible on the skin. Most people notice it and wait. Some of them wait too long. Sign 3. Skin changes on the lower legs. Color, texture, and temperature. The skin of the lower legs is a remarkably accurate display of what is happening in the circulation beneath it. Brownish or reddish-brown discoloration around the ankles, a condition called hemosiderin staining, develops when chronic venous insufficiency causes red blood cells to leak out of the veins and break down in the surrounding tissue. The iron in those cells deposits in the skin, producing a permanent stain. It does not hurt, it does not itch, but it is a visible marker that the veins in the leg have been under sustained pressure for a significant period of time. Shiny, taut skin on the lower legs, skin that has lost its normal texture and feels stretched, can indicate that fluid has been accumulating in the tissues long enough to hair loss on the lower legs and feet, combined with skin that feels cooler than normal when touched, points in the opposite direction. Arterial insufficiency, where blood flow into the leg is reduced rather than backed up. A localized area of redness, warmth, and swelling, particularly if it spreads and is accompanied by fever, is not a circulatory problem. It is cellulitis, a bacterial skin infection. In people over 60 with diabetes or compromised circulation, cellulitis can progress rapidly and requires antibiotic treatment promptly. What to do? Hemosiderin staining warrants a venous evaluation. An ultrasound of the leg veins can assess venous insufficiency and rule out DVT. Cool, hairless, shiny skin warrants an arterial evaluation. Spreading redness with fever, same-day medical attention. The next sign is the one I mentioned at the start, the one most often explained away. Pay attention to the specific pattern. Sign 4. Pain in the legs that follows a predictable pattern. Pain is the body's most obvious communication tool. In the legs after 60, the location, timing, and behavior of pain are more informative than the pain itself. Pain that appears consistently after walking a certain distance, say 2 blocks, and disappears within minutes of stopping, then returns when you walk again, is intermittent claudication. The leg muscles are not receiving enough oxygenated blood to meet the demands of walking. The arteries supplying them are narrowed. Rest reduces the demand enough that the available supply becomes sufficient. Then you walk again, and the cycle repeats. This pattern is so specific that it is one of the most reliable clinical indicators of peripheral artery disease. Yet it is routinely attributed to joint pain, muscle fatigue, or just getting older, and goes uninvestigated for months or years while the underlying arterial disease progresses. Pain that is worse at night and in the leg at rest, particularly if hanging the leg off the bed provides relief, indicates more advanced arterial compromise. Gravity helps bring blood to the foot when the leg is lowered. When rest pain appears, the arterial supply is no longer sufficient even without the additional demand of walking. Pain along the back of the leg, worsened by bending the foot upward, that developed after a period of immobility, a long flight, a hospital stay, a stretch of reduced activity, is a warning sign for DVT until proven otherwise. Low back pain that radiates into the buttock and down the leg, worsened by walking and relieved by bending forward, is the pattern of lumbar spinal stenosis, a narrowing of the spinal canal that compresses nerves. This mimics vascular claudication closely enough that distinguishing the two sometimes requires testing. What to do? Reproducible walking distance pain that resolves with rest. Request an ankle brachial index. Rest pain in the foot or toes. Urgent vascular evaluation within days. New leg pain after immobility with one-sided swelling. Same-day evaluation for DVT. Sign 5. Varicose veins that are new, painful, or rapidly worsening. Varicose veins are so common after 60 that most people consider them purely cosmetic. For many, they are. But 3 specific changes in varicose veins warrant medical attention rather than reassurance. First, a varicose vein that becomes suddenly hard, red, and tender along its course has developed superficial thrombophlebitis, a clot within the surface vein itself. This is not a deep vein thrombosis, and in most cases, it is not dangerous. But when it occurs close to the junction between the superficial and deep venous systems, near the groin or behind the knee, there is a risk of the clot extending into the deep veins. An ultrasound determines whether treatment beyond anti-inflammatories and compression is needed. Second, varicose veins that have been stable for years and suddenly worsen significantly, become larger, more numerous, or begin causing significant aching, heaviness, or swelling, suggest that the underlying venous insufficiency has progressed. This may be driven by weight gain, prolonged immobility, or a new obstruction in the deeper venous system. Third, a varicose vein that bleeds. The skin over a prominent varicose vein can become very thin over time. A minor bump can cause significant external bleeding. This is controllable with direct pressure and leg elevation, but it requires a vascular evaluation to prevent recurrence. What to do? Stable, painless varicose veins, low urgency but worth discussing. Sudden redness, hardness, and tenderness along a vein. Evaluation within a day or two. Bleeding from a vein. Direct pressure, leg elevation, and medical attention the same day. The next sign happens without pain. That is exactly what makes it dangerous. Sign 6. Wounds on the feet or lower legs that won't heal. A cut or scrape on the lower leg that, in a younger person, would close within a week, in someone over 60 with compromised circulation, can remain open for weeks or months, sometimes indefinitely. Healing is an oxygen-intensive process. It requires vigorous blood flow to deliver the immune cells, nutrients, and growth factors that rebuild tissue. When arterial disease reduces that flow, the healing machinery cannot operate. When venous disease causes sustained fluid accumulation in the tissue, the local environment becomes inhospitable to healing. When both are present simultaneously, which they often are in people over 60 with diabetes, even minor wounds become serious problems. A wound on the lower leg or foot that has not substantially improved after 2 weeks is not a minor issue. It is a vascular problem with a wound on top of it. The wound cannot be addressed without addressing the circulation. Diabetic foot ulcers deserve specific mention. They develop at pressure points, the ball of the foot, the heel, the tip of a toe, often without pain, because the same diabetic neuropathy that damages the nerves supplying the foot reduces sensation. The wound is discovered late, already infected, already deep. What to do? Any wound on the foot or lower leg that shows no clear progress toward healing after 2 weeks. Vascular evaluation, not just wound care. A wound in someone with diabetes that has been present for more than a week. Do not wait. Sign 7. Numbness, tingling, or burning in the feet. The feet contain the longest peripheral nerves in the body. They are the first to show signs of damage, from diabetes, from vitamin deficiencies, from certain medications, from compression, and from reduced arterial blood supply. A burning or tingling sensation in both feet, typically worse at night, starting in the toes and moving upward, is the classic pattern of peripheral neuropathy. In people over 60, the most common cause is diabetes or prediabetes, even when blood sugar has been managed. The second most common cause is vitamin B12 deficiency, which is more prevalent after 60 due to reduced stomach acid, and the long-term use of metformin or proton pump inhibitors. Both are treatable when identified early. Numbness that affects one foot or one specific part of the foot, the top, the sole, one side, is more likely caused by nerve compression, the sciatic nerve, the peroneal nerve at the knee, or the tibial nerve at the ankle. The location of the numbness maps directly to the nerve involved. Progressive numbness that moves from the feet upward over weeks or months, combined with weakness in the lower legs, warrants neurological evaluation to rule out conditions affecting the spinal cord or peripheral nervous system more broadly. What to do? Bilateral burning or tingling in both feet. Request a blood test for fasting glucose, HbA1c, and vitamin B12. Localized numbness in one foot without an obvious compression cause, neurological or vascular evaluation depending on the pattern. Progressive ascending numbness with weakness, prompt neurological evaluation. What your legs are telling you. None of the 7 signs in this video require panic. Most have explanations that are manageable and treatable, particularly when caught early. What they require is attention, the kind of attention that distinguishes between a symptom that has been present for months and is stable, and one that appeared recently is changing, or fits a pattern that points somewhere specific. The legs have an enormous amount of vascular, neurological, and dermatological surface area. They are one of the body's most reliable early warning systems for heart failure, for arterial disease, for venous disease, for diabetes complications, for nerve damage. The signals they send are often subtle. They are almost never silent. If you identified with 2 or more of the signs in this video, bring that pattern, not just individual symptoms, to your doctor. Ask specifically for the tests that match what you are describing. The ankle brachial index for walking pain. A venous duplex ultrasound for swelling and skin changes. Fasting glucose and B12 for numbness and tingling. Your legs have been carrying you for over 6 decades. They are still trying to,